Hello friends, this is Dr Massimo Buda from Naples, Italy. I deal with digital procedure in dentistry and particularly I use in my daily practice computer-assisted procedure in implantology. Today I would like to share with you a clinical application of this procedure in a case of the edentless mandible. Which is the reason why we should use 3D computer-assisted technology in dentistry? The most important benefit we can get from a 3D reconstruction is the chance to get to know every aspect of the patient's anatomy, both hand and soft tissue, before operating. Once we know the anatomy, we can plan the appropriate implant position in relationship with the bone of the patient and the prosthetic design. Today, we use this procedure we have defined prosthetic guided implantology 3D computer assisted. We have understood that this is a system in which the surgical template produced following the software planning indications put in relation the anatomy of the patient with the prosthesis prepared before surgery, with safety and predictability. The computer-assisted implantology is a complete procedure. First of all, it's a diagnostic system. After that, it allows us to plan the necessary number of implants coherent with the prosthesis design. Also, it lets us to build the prosthesis before doing the clinical procedure. Finally, it permits us to do surgical section, placing the implants through a surgical template and at the end to apply the immediate loading prosthesis. I will show you the basic workflow. First step of the preparative of protocol is the preparation of an appropriate guide for CT/CB scan, able to support a 3D marker. So far, in this edentulous lower jaw, we can see clearly the anatomy of the bone and the position of the nerves. Now you can see in fact how the software works. First of all, we examine the patient anatomy moving the vertical slice on the maxillary arch. We can choose the section in which probably we wish to insert the implant. In this case, 4 implants, 2 anterior parallel and 2 distal tilted. After that, with an intraoral scanner, soft tissue are detected, and we match this STL file with the bone of the patient to have a perfect virtual representation of the real intraoral anatomy. At the same time, the laboratory scans the wax-up of the prosthesis. This STL file is matched with the 2 previous, and the reconstruction of virtual anatomy of patient and the new prosthesis is completed. Now we insert the implant in relationship with the bone, the soft tissue, and the prosthesis of course. In these cases, 4 implants, 2 anterior parallel at the level of the lateral incisor and 2 distal tilted. As you can see, in the distal region, we perform a cross section with an oblique angle to the maximum of 45 degrees in order to place implant in adequate amount of the bone in the front area of the emergency of the nerve. In the same session, we place 3 horizontal anchor pins to fix the surgical template to the anatomy of the patient. Then we will use of titanium abutments in predetermined height to place the prosthetics connection above the gingival tissue. These abutments, called pad abutment or multi-unit abutment, will be straight on the anterior implants and angulated 30 degrees to distal one to parallelize distal tilted implants and to permit an adequate insertion of the screw retained prosthesis. Once finished the placement of the implant, our software processes the data and create a virtual model and a virtual surgical guide, CAM phase. Then, using this data, the milling center produced 3 devices, CAM phase, a model with implant, a surgical guide, and the fixed prosthesis. This concludes the first part of this lesson. I hope to meet you soon for the second part. Have a good day.